Dr. Scott Wissman, who is a pediatrician and owner of Wonder Years Pediatrics, and joins us now live from Washington, D.C. Welcome to the program. Tell us, how significant
Hi.
is this approval by the CDC?
Well, I think this is extremely significant. This is something that I know a lot of my patients and a lot of parents have been waiting for. This decision actually affects the lives of 28 million children between the ages of 5 and 11. So I definitely think it is a game changer, because a lot of the patients that we've been seeing in the office, and I think what we've been seeing around the nation, are those that are back in school. They're the ones that are kind of on the front line of being exposed, and certainly that has disrupted classrooms, that's disrupted families, and it's time that I think for having this game changer to really kind of make this COVID crisis continue to go away, so we see less and less of it.
And Dr. Vissman, you said your patients, the parents that you meet, they've been waiting for it, but there is so much hesitancy, isn't there? Also, we heard that in the
Yes.
report we played before.
Sure. And I think, as a parent as well, I have 3 children. As parents, we want to do the best for our children. We want to give the best to them. And certainly there is some hesitation. I think the perceived notion that the vaccine is new, that if this is something that really does affect children. But we do know that there's been more than 7 billion doses of this vaccine that have been given over the last year and a half. So we have one of the largest bodies of data available, really, for arguably of any vaccine. We know that the mRNA technology has been around for quite some time, even prior to COVID. So there's pretty powerful evidence that, at least from a long-term standpoint, the risk is really low. And we do know that thousands of children have been hospitalized from COVID, and several hundred that have died, which is quite tragic. And we've seen that, affecting not only with children, but the effects of their own parents and loved ones that have had severe complications from the COVID disease itself. So as a parent, you want to weigh the risks of the vaccine versus the risk of actually getting COVID and getting long-term complications that we really know do affect children and affect adults as well.
And a doctor I spoke to yesterday said, every vaccine is always new. But just back to that hesitancy, what exactly is behind it? Is it the fact that it's a new vaccine, or is it, the side effects, potential side effects?
Yeah, again, I think it is. Yeah, there is a bit of that hesitancy. The hesitancy probably is because of this perception that it is new, that it's been out for about a year and a half. But again, when we're looking at vaccines, the technology has been around for decades prior, even though that this has been marketed as they've used it as a vaccine for COVID itself. But the fact that we know that a vaccine itself, is opposed to, say, a medicine that's continually given with side effects over time, a vaccine itself, once it's given, it basically does its job. The body makes an immune response, and the vaccine itself does not linger around for much for a long time. In fact, it's really almost immediately starts to degrade, and the body gets rid of it. And we know from a vaccine standpoint, from vaccine technology, vaccines themselves do not have a long-term risk in the future, because once it's in the system, the body immediately makes an immune response, and then it's gone, almost like an email or a Snapchat, as I described to some of my teen patients. It's in the body and it basically disappears, but the effect does live on, in the sense of your body makes the immune response, the antibodies against in this case, the spike protein against COVID.
Thank you so much. You've explained it so well and so clearly. Great to have you on the program, Dr. Scott Wissman. Appreciate your time.
Thank you very much. Thank you for having me, and hope that everyone stays safe and healthy out there.
Absolutely.